nitty-gritty of how, what and why the immune system and inflammation and all the rest of it. I've been working with women and the herbal medicine and this wider functional metabolism and all the evidence base with it. So I'm just going to ask you to take my word for it. If you do that and do the things that I'm advising you to do with your food, and next big thing is sleep. Healing takes place when you're asleep. So there's no point in going to bed at 1 o'clock with your Facebook or TikTok or Insta or YouTube and then expecting your hormone system to be going, yay, we're grand, because it won't be grand. It is for many people, but not you probably if you're listening to this. But I will say that the summary at the end of all of that is that these are systemic, complex, immune modulated, chronic inflammatory conditions, with some overlap, especially with the endometriosis, with autoimmunity, right? So not simple, but some of the approaches are very simple. Just to differentiate a little bit for the PCOS, the endometriosis I would put as the specific qualifier for that is the antispasmodics and motility, because the endometrial tissue is traveling like anti-gravity and anti-motility, probably up through the fallopian tubes. There are other theories, so even that is not as straightforward as it sounds. So the endometriosis might need more antispasmodics. And the PCOS is has more of an implication of the metabolic syndrome, which is a condition of insulin resistance. So every cell in the body doesn't use insulin as well as it should. And that has associated inflammation, and problems of elimination would be one of the strategies that I would most use. And the intervention with diet would be an emphasis on no sugar, no added sugar, I should say. Fruits and vegetables are good. These are all included in the Mediterranean diet. So if people, I don't prescribe or describe very severe dietary interventions, but if you have sparkling good health, energy, sleep, you wake up in the morning refreshed, your concentration and focus is fine, you can have 80% good food and 20% happy birthdays, okay? But if you have a condition which is inflammatory and chronic and multi-systematic, then you need to have 90% good food, cooked, raw, it's anything that your granny or your granddad could have cooked in the kitchen, all right? So, and 10%, because who's not going to have a piece of their birthday cake? That would be an unreasonable thing. You might need to do this gradually. None of these things can be done overnight. When people come to see me, if they have moderate to severe symptoms and they come to see me in clinic, I say to them it's a year, 18 months. For some reason, people have this idea that if you go to a herbalist, it should work quicker or be more, right, let's get on with it, than the pill, say, or other hormone manipulations, or but it takes time. We're turning vicious circles into virtuous circles, and you do it one step at a time, one day at a time. Hormone regulation is particularly influenced with PCOS, and the connection between the gut and insulin and the liver would be, and also more specific imbalances of amplitude and frequency to do with the hormones. So having lots of hormone tests done doesn't necessarily give that many clues as to what's actually happening at cell level. And you also have a neuroendocrine dysregulation, as I said before. So this is all about the conditions that are created whereby the egg in the ovary can't develop and burst at ovulation time. So it all drags on, and the follicle, which should disappear once the egg is released, it develops into a cyst, and then you get multiple cysts over time. And over time, can be over a number of years. So all of this leads to an inflammatory condition or an inflammatory baseline, which is a vicious cycle. Okay, so the other thing in common for both is that we live in the environment of endocrine disruptors. So clear all the cleaning stuff from under your kitchen cabinet and your bathroom cabinet. There's lots of YouTubes and TikToks on how to use natural things like baking powder and lemon juice and vinegar, and if not, you can buy these in either in select stores where you bring your bottle and you get them refilled. We have one in Galway and one in Moycullen. Might be others that I don't know about, but look for some near you. Or you can order them online, so that would be good. The other place where there's a lot of chemical stuff is the fire retardants in sofas and in nylon carpets. So if you really want, if you're replacing your flooring, use natural, as much as possible in the home, use natural and if possible organic fabrics, stuffings for your cushions, all these things that release things into the environment on a regular basis over the years. Need I say, don't smoke cigarettes or vape. Easy, isn't it? Okay, no, it's not easy. I know it's not easy. So what you want to do is, again, you can't do all of these things all at the same time. And a lot of the time people need mentoring if the problems are moderate to severe. So make an appointment with your local herbalists or see us online. If there's a local well-qualified herbalist, that is a preference. This is about you being well and getting the best treatment that is available to you wherever you are. Okay, so endocrine disruptors, and yeah, you can check all of those out online. Okay, so how far have we got? Regular meals. This, with hormone issues like this, I don't particularly recommend fasting, particularly for the PCOS. PCOS and dietary advice. If you're a binge eater or have multiple cravings, including for industrialized food, which is your salt and sugar and cheap nasty fats, then if it's to the extent of food binging, then all of this advice about losing weight and not eating sugar, you might as well sail it in the wind. So that's why I'm very cautious in advising people about diets or special diets or keto diets or this. The one that there's the most evidence for is the Mediterranean diet. It's not sexy, it's not exciting, it's just very tasty and colourful, and eat seasonally if you can, and enjoy your food. That's what I would say. Don't starve and binge and build up to a whole lot of problems. If you have an eating disorder, please get help. Don't live with it forever. It's very difficult. One of the most important things to do with anything to do with female metabolism and physiology is fibre. It goes for the whole population, for men as well, but particularly important for women. And the reason for that is that fibre escorts the metabolic breakdown products of our very wonderful complex hormone reproductive system. And if you don't have enough fibre, all the breakdown products are not escorted out. So the fibre is an escort system for what you've already used and worked on and don't need anymore and need to eliminate. For therapeutic use, like you look up high fibre foods, okay, then you're going on to, is there something else that I can add in for added benefit? And I would emphasize the soluble fibers, mallow root, 1 teaspoon 3 times a day, and or a combination with psyllium husks. Now, if you have IBS and you suddenly start eating a load of lentils and psyllium and chickpeas and whatever, they're all good for you, but they can drive you crazy. So in that case, start with the mallow root and gradually increase the psyllium seeds or husks, either, and then increase the bean family, the chickpeas and lentils and all that. So that's just a very practical thing. Now we have our secret sauce. It's not a sauce at all, it's seeds. This is fenugreek seeds. Do I have them here? I have lentils. I think I have everything here except the fenugreek seeds. Anyway, it's a bag of seeds. You can sprout them if you want. That's another step towards a distinction. If you're looking for a merit badge. So the fenugreek seeds is a very nice piece of research, which I can put at the end to my assistants. And 1 teaspoon a day is 3 to 5 grams. And they had a very, very good response for endometriosis in particular, using 2,700 milligrams. So 1 teaspoon throughout the day. You can just put them in yogurt and swallow them down. You can put them in your cooking, which is even better. It's one of the curry, mild, slightly bitter taste if you have too much of it, especially to start with. Bitter foods are part of the solution for all of this. The fenugreek seeds have fiber. See, this is again one of the secret weapons of herbal medicine. With fenugreek seeds, you get trace minerals, fiber, and hormone balancing. Okay. Just a little note, the reason why it's beneficial is because there are plant estrogens, and where you want to modulate. Modulate is if it's too low, you elevate it. If it's too high, you minimize it. So with the plant estrogens, if you have a condition which is estrogen dominant, which some PMSs can be, premenstrual syndrome, then it will moderate it down. Because it occupies the little gaps where it's designed for estrogens, but the plant estrogens are hundreds of times weaker than our own biological estrogens. So it takes up the space. It's like, you know, if the car is in the parking space, you can't go into it as well. But overall, it'll moderate down the estrogen. If you don't have enough estrogen, like after the menopause, then these weak estrogens will help keep everything ticking over nicely and also have an impact on bone strength. Before I forget, keeping hydrated. Cheers, guys. Okay, you can do that either with your water or with your tea, which I will show you. One of the big advantages of using tea is, there's the tea, is that a lot of people find it more palatable than just water, and this one actually tastes nice. So it appeals to them to drink more, which is a happy way of doing things. Sleep. We talked about neuroregulation and neurological sensitivity. And this is a physical thing. This doesn't mean it's in your mind. This is actually, you know, your nerve endings and the synapses and everything go a little bit off key, like singing off key. It's not a disease, but it's like, I've just thought of that actually. That's a very good analogy. I call it reflection, prayer, meditation, or mindfulness. So you can take your pick. Okay. And this is about having agency over regulating your emotional reaction to triggers, managing your work, your focus, your concentration, your menstrual cycle. So, I mean, another trick is if you have very, very bad periods, then what you do is you do all during the bleeding time, you rest a bit more, but you function as well as you can, unless it's very heavy bleeding and the pain of endometriosis. So we have very painful endometriosis, okay? So you do what you can, you manage what you can. The first half of the cycle is when you do the heavy lifting. You do preparing for things that you need to do. In the second half of the cycle, you make sure you've got your food basics in, you plan your meals, you do, like, this is all ideal, but you're getting the drift. If you're in school, you get the assignments in. I've had quite a few questions about PCOS in teenagers. So you plan your homework and your assignments and whatever you do all of the kind of background work for it, so that the second half of the cycle is easier. If you're in work, well, then you don't volunteer to do your presentation during the second half of your cycle. You would do the presentation if that's a bit nerve-wracking. You get the idea, guys. Okay. Now, to do with all of that pain, particularly with the endometriosis, 1/3 of women with endometriosis have been passed over for promotion at work, and 1 in 6 report that they've actually lost their jobs due to needing to take time off to manage their endometriosis. And there was a very good study showing how kind the COVID-19 lockdown was for women who were suffering from this condition. So we could be developing more flexible ways of working to suit people who have conditions like this that are very variable, right? So speaking of pain, you can make your own blend. I don't have it on stock that I provide to other retailers, but if you contact us and get 100 mils of valerian and 100 mils of cramp bark, and there's no other names that are confused with them. It's Valerian officinalis and Viburnum opulus, or cramp bark, okay? And you put the 2 of those into a jug, mix them up, pour them back in, so you have a blend of them. And if you take 5 mils up to 8 times a day, so every 2 or 3 hours, and if possible you get in before your period starts. You don't wait until you're in agony, okay? So this has been very helpful. And the other thing is, if you look up YouTube how to use a castor oil pack, and the other thing that's very, very helpful is the Epsom salts baths. Not quite sure why. Antispasmodic, absorbing magnesium in a route other than your gut, because absorption might be affected because of the motility and the inflammation. So the Epsom salts baths, they're things that people find very helpful. You need a good mugful. Here they are. Here we have rose petals in these, which are again very nice. You can add some essential oils as well if you like, and you want that amount in a bath. Okay, this isn't. I'd rather you have 1 good soak a week rather than 2 half soaks, and you have it as hot as you can bear. Stay in as long as you can, 20 minutes. Wrap yourself in an old bath sheet or an old regular sheet and get into a warm bath. So put the hot water bottles in the bed before you get into the bath. And you will sweat it out. 2 things with these conditions: laugh and sweat every day. So movement is very important. So I want to see you dancing around the kitchen, go to classes, go swimming, have hot and cold showers. That'll make you laugh. But lots of movement, and preferably something that you will do on a regular basis. It can be singing one song while you're hoovering, dancing to one song while you're hoovering or washing the floor, or run a little bit on your way to school or college or the bus stop or whatever, do some cycling, whatever it is. Yoga, qigong, tai chi. They're the things that really open up drainage, lymph, whatever. But they might not be accessible to you, although more and more are being taught online. Good thing, bad thing, mixed, not mixed. I certainly wouldn't be learning yoga, the kind of yoga where you put your feet behind your head online. You know, you need a good teacher. But some very simple yoga poses like the downward dog, back strengthening exercises, those kinds of things. There are some good basics, but there's yoga classes all over the place. So that's movement, laughing and sweating. Okay, so the gut flora, I do advise people to take a probiotic. And ongoing with these conditions, I would recommend a probiotic course, you know, usually lasting 4 to 6 weeks, whatever is on the packet, and 4 times a year. All these supplements and everything are expensive, so this is just giving the body an opportunity when it gets some of the usually beneficial, what we know of a very complex system. When it gets an opportunity, it will kind of, it's a bit like planting seeds in your bed, which in your flower bed, that you want the helpful ones to grow and the weeds not so much. So it's that kind of thing. So you just give them that opportunity for 4 courses a year. Okay, and avoid unnecessary antibiotics. There's one other food I recommend, which is the rutin, which is buckwheat. You can make pancakes. There's lots of ingredients, lots of recommendations again that you'll find recipes for. But it's also in the white pith of oranges and the threads around the segments of oranges. So there's lots of complicated reasons why berries are good for one thing, oranges and the pith of oranges are good for, so lots of variety in your 7 to 9 vegetables and fruit every day in the Mediterranean diet. Okay. So the probiotic, vitamin D, B complex, essential fatty acids, spices, and I've mentioned the castor oil pack. So if you see the diagram that I've done for you, which is the hormone Olympics, on the very top is the pineal gland, on the second level there's the pituitary and the hypothalamus, and on the third lower rung there's the adrenal gland in the middle. The adrenal gland is our fight or flight response. I've my own picture here. Is the fight or flight response. So that will be protected at all costs. So that's why when there is a tendency to imbalances in women, the pancreas takes the hit or the thyroid takes the hit. In younger women, it's more of a tendency for the pancreas to take a hit, and around the time of the menopause, the thyroid takes a hit. For any of you who are under 48, it's not going to be much of a comfort to you. But the cure for these is the menopause. I'm not wishing it on you at the wrong time, all right? But it's certainly a pause and a change. But it actually resolves endometriosis and PCOS and PMS and fibroids and migraine. So don't believe everything that you're told about the menopause being a total disaster. 1/3 of women have no problems at the menopause. 1/3 have mild to moderate problems. And I'm sure I've done a talk on this somewhere else on YouTube. But anyway, maybe I'll do it again. So coming back to this, the pineal, pituitary, hypothalamus, and then the thyroid and the pancreas, and then the gut and the gut flora the bugs in your gut actually produce hormones, and your gut lining produces hormones. And then on the other outlying flank, the sex hormones and fat. One reason not to be too skinny after the menopause is that you miss out on that lovely production of estrogen, with a little bit of fatty tissue. So everything in physiology has good thing, bad thing. Estrogen is a good thing, bad thing. Too much, too little. So as my mother always said, everything in moderation. Pause. including moderation, because she loved a good party. So this isn't about being miserable. This is about enjoying good food, good sleep, lots of movement, lots of laughing, lots of sweating. What's not to love? Okay. So now we're going to come in. Now we'll come on to the herbs. Now, you don't have to be perfect at all of the above in order to start using the herbs. So, am I missing something? No, okay. I am. There was another bit. So, having described all the, oh no, I have it here. Having described all of the things that, the systems that can be affected by these conditions, you're not going to be surprised by the actions, the things that I want the herbs to do, and that they're well capable of. So I want liver herbs, because that's the enzymes that break down all of the products of all of this erratic physiology. So I want liver enzyme herbs. I want alteratives. Now this is a herbal term, which means that I want to improve the elimination via bile production, lymph flow and drainage, kidneys, and sweat. And I also want to modulate the immune system. I want anti-inflammatory actions, because all of this results in inflammation. Antispasmodic, particularly for the endometriosis. Antispasmodic because of the motility issues. An adaptogen. An adaptogen is a herb that, without stimulating, the ones I want to use are ones that don't stimulate the limited resources that you have, because you're exhausted from all of these problems, but ones that will help you perform better with the energy that you have. And I also want to use bitters, because bitters have a specific place. You know how bitter good chocolate is? That's the kind of bitters we're talking about. So what do I have here? I have loads of stuff here. I have my book that I've just written. It's taken a long time, 10 years, and it gives you the reasons why they didn't teach me about all of this in medical school, and that's the answer. Okay, and we just launched it before Christmas. So, but the core of all of this is the women's blend, which is this one here. So this is a tincture bottle. So there is a small amount of alcohol in it, which you might want to consider for anybody who does have alcohol problems. And what's in it? I'm going to read through them all. Kelp, red clover, Chinese angelica, dandelion root, peony, lavender, bacoba, Siberian ginseng, and sage. What are they going to do? Much more important. Kelp is mineral rich. Iodine, very important for the thyroid gland, and we know that the thyroid gland is one of the key sentinels. It's a bit like the knight if anybody plays chess. So iodine, nutrients, trace minerals that are no longer in the food supply because the soil has been depleted, and fibre. Red clover has a lymph drainage action and its hormone balance. Chinese angelica is anti-inflammatory, antispasmodic, and hormone balance. Couldn't read it there for a minute. And the dandelion root supports liver enzymes. It also helps the production of bile and the elimination of bile. And it needs fibre in order for a combination of the fibre and the bile to escort out the hormones. Peony is for hormone modulation and nourishment. It's a nourishing herb for the hormone system. Lavender, who some people don't like lavender, but most people do. It's a nervine. It supports the nervous system, and it's also antispasmodic and can help the digestion. Bacoba, again, antispasmodic, anxiety, and also helps with cognitive function. And when you have a hormone balance, it very, very often affects your focus and concentration. Okay. Siberian ginseng is good as an adaptogen to cope with stress and using energy resources that you have wisely. so that you perform better. And then the last one is sage, which is good for hormone balance and cognition. So can you see the clever trick with the herbal medicines? Out of the 80 herbs that I'm looking at in my dispensary here, I'm choosing ones that have multiple action. And also ones that complement each other. And that's the skill of using blends of herbal medicines. And this has got a wide, because everybody is different, I have things in there that will give a wide coverage. So if one person needs more of this kind of hormone modulation and another person needs a slightly different one, your body itself has the knowledge, the healing power. And herbal medicine is very much about accepting that our bodies are wise enough to heal should we give them the right environment to do so. So this is all about giving them clues and nudges. But they also work quickly for symptoms like the pain relief. So it's a combination of both. In the tea, which I mentioned before, we have red clover, wild oats, dandelion leaves, yarrow and rose petals. And the red clover is hormone balance and lymph drainage. Wild oats is for stamina in the nervous system. You might be aware of the expression to sow your wild oats if you're a Casanova. Most younger people probably don't know anything about Casanova. Anyway, he was quite the amorous fictional character. Where he has a very busy love life and he needs the wild oats to maintain stamina in the reproductive system. The dandelion leaves help eliminate through the kidneys. In particular, they're also very nourishing, as is the dandelion root. The yarrow is very toning. So it's a nice mixture between toning and antispasmodic. It means that the cells are toned that are lining the channels. But the antispasmodic means that the motility is going in a nice direction. And the rose petals. You can always, guys, put rose petals in your tea. They are just so nice. Having these conditions means that you feel that the world can be a very unkind place, especially going through these cycles every month. You feel like you're living in a fun fair, except it's not really funny. So rose are very calm, soothing for the gut, and very soothing for the nervous system. Okay. The other one that I have to mention is the cinnamon. I had one question. Cinnamon is particularly useful. I would say it's useful for both conditions, but particularly for insulin resistance. And we did have a question whether cooking means that those effects are neutralized, and they're not. They persist through cooking. Thank you for a very interesting question. We have the seaweed flakes called sea salad. I actually put it in my sautéed onions and I put them on a very low heat so that it all infuses nicely and makes really nice meals. The cinnamon, you can also use the cinnamon sticks. For people who have very, very heavy periods, this is the iron that I recommend. Liquid iron and vitamin formula. It all comes from plants. How are we designed to absorb iron? From plants, not from metal iron. So this is much less likely to cause constipation and stomach upset, which would defeat the purpose. And you can combine it with pharmacy iron as well. Sometimes people can only tolerate half the recommended dose, but they can do fine with half the recommended dose from the pharmacy and top it up then with the Flora-Vital. We have here organic linseeds, and this is another very good source of fibre and also plant estrogens. So we love the double whammy. Okay. And this is the chase tree. Be careful if you're in your reproductive phase and intimately active, because chastery can promote fertility. So you need to be very careful to take steps to avoid that. You are warned. Okay. We also have the fenugreek as capsules. That's entirely for convenience. I go food. One of the reasons why I promote the food primarily is because once people get used to using things in their food and their grocery shop and their kitchen, then they use it for life. And they're very good for maintaining your cardiovascular health, avoiding diabetes, avoiding dementia. I love all of these side benefits from using herbal medicines. So fenugreek, having said that, the capsules are very, very handy, and particularly if you're going away overnight, if you're going, so you don't have to choose between one or the other. You don't have to choose between herbal medicine and the medicine that your doctor uses. If you're going for very intense treatment, I recommend you see a medical herbalist, because you don't want to waste your money on something that's going to be overwhelmed by your medical protocol. You want something that will support your medical protocol, and that would mean using an individual approach. Okay? I think I found everything. Oh no, I didn't. This is carrageen. If you want our regular seaweed from our own shores, the carrageen, this is 50 grams. You can compare the price. You can go and harvest your own seaweed on an area that's not polluted, an area of the sea that's not polluted. And again, there's loads of YouTubes on how to do that. Very simple, nothing dangerous on the seashore. It's not like mushrooms. Okay. Gosh, we have got through a lot. Do you want to give me a time check there, guys?
So that's been 45 minutes.
Right, okay, 5 minutes over. So I'm just going to take a look at the questions. Thank you, everybody. This is Aileen. Laparoscopy showed endometriosis, adenomyosis, which is endometriosis in the uterine wall. Still using the coil. If you're 55, it's more related to when your last period. If you haven't had a period for a year, then your endometriosis will not be affected by keeping the coil. So I would wait until a year after your last period and then take the coil out. Thanks, very practical question. Do I have more questions, guys? Did I leave them in there? Yeah, there was more. There was a 16-year-old with PCOS. Thanks a million. Daughter had endometriosis following the birth of her baby boy. This is Helen. And she was told she might not conceive again. She didn't even know she had it. And that, I think I've answered that in the mystery of endometriosis. Any advice would be appreciated. You don't say what age she is. In general, guys, women are leaving having babies for too long. Many are having problems. Male sperm quality in industrialized countries has deteriorated up to 50%. I don't have the exact figure now. Don't rely on being guaranteed to make your family. The closer to 33, unless it's changed, 33 is when it starts going down. Not scaring you guys. So if she, it doesn't say what the extent, Helen, of your daughter's endometriosis was. And again, depending on age, life circumstances, support, all of the things, look, it's so complicated. Then she would be advised to have her next baby, don't leave too long a gap, so that if she did need help, many people who have fertility problems with endometriosis can be helped by fertility treatment. So that's, I hope that was what they were thinking of when they told told her about the endometriosis, because there's no point in knowing something you've no symptoms of unless it's an aid to living your life. So I would use that information as an aid to the possibility of having problems. But many people with endometriosis conceive and have babies. They're not known to be infertile because they're presenting with pregnancy, if you know what I mean. So, but there are issues. Anything to reduce excess hair growth. It's too painful to wax. It's an unusual name, so I won't call you by your name. You could try threading, right, where you go and they wrap a thread and yank it out. Or laser, if the waxing is too painful. All of the things that I've described will be aimed at moderating your hormone amplitudes and levels. So I would do all of those things. Yeah, okay. So waiting laparoscopy to confirm endometriosis. They're concerned about it. They haven't explained what I can actually do about it. They've just told me to go on contraception. Contraception just means that you are taking a level amount of hormone, stopping, and then when you stop it, you have a bleed because you've stopped the drug. It doesn't actually heal anything. It does make sure that you have enough estrogen for your bones if you have PCOS and you're not having regular periods, you're having fewer periods than normal. So that can be an aspect that you need to cover. Not planning to get pregnant anytime soon, but you want to keep an eye on your fertility. And it is unfortunately, women do have a time clock, and it is about finding the right, if you're hell-bent on having family and it's that important to you, it's not important to everybody, but if it's hell-bent on it, well then you're looking to be in a relationship that provides that kind of support, rather than just leaving it to, oh, I wonder if. You're looking for the qualities in that relationship that will lead to you being able to fulfill your wishes. So that's what I would call keeping an eye on fertility in the future. Nothing is simple in all of this. But I have sat with people who have cried because they've realized that they prioritized other things in their life, and they would be going, I wish I hadn't, right? Herbs are best for endometriosis. Joan, hopefully I've given you some guidelines. Any herbs that are safe to take with metformin when dealing with fertility issues, somebody with the diagnosis. A lot of these herbs can be used alongside metformin. There's very few drug-herb interactions. If you're a diabetic, some of the herbs can greatly improve the stability of your sugar management. So you might need to reduce your drugs. So you do it in combination with monitoring your sugars and being advised about your medication by your medical team. Or is it very much down to whether you're insulin sensitive? What a great point, Susan. There are thin people that aren't hairy that have PCOS. They have all of the same parameters, but they just don't have that influence of it's called hirsutism, which is excess hair, or excess fat cells and all that go with that. They don't know why. There might be that there's more of a genetic influence, and there is a genetic influence in both of these. As I say, there's such a lot we don't know about these. And the women's hormone, immune, gut, brain axis is so complicated. And then you throw in a whole field like the gut microflora that we're only beginning to imagine the complexities of it. So there's more questions than answers. But the answers are universal, right? The sleep, the food, the movement, the laughing, the meditation, the whatever. You're not helpless. This is about empowering you. Worse symptoms leading up to my period, particularly 2 or 3 days beforehand. It's a relief once my period. So the herbal supplements, Yeah, this is important, because if you're describing PMS, not particularly in your question related to those illnesses, managing your cycle according to your work and your life and your studies according to your cycle is the important thing. All the food and you take the herbs. The women's blend is equally useful for you, and the tea. The one or the other, if it's mild to moderate symptoms, both together if they're very severe. If it's really severe, see a herbalist. So that would be good. And then you're talking about the essential fatty acids. Some people do better with PMS if they have evening primrose oil or borage oil. So you can try alternating some of those, and the B complex. As a parent, what symptoms should I watch out for in my daughter as she goes through puberty? There could be signals of PCOS or endometriosis beginning to develop. Gosh, Katrina, I wouldn't be anticipating it, because that's you're kind of approaching your daughter's teenage years. Instead of celebrating all that being a woman is going to mean for her, you're thinking about what symptoms. If she does get difficulties, that's when you kind of go, oh, I wonder what's happening. So yeah, the vast majority of young people go through puberty and go through issues if she go through a little bit of discomfort, but it's nothing too much to worry about. So only if it's very severe and interfering with her life or causing severe pain. Okay, and Kate has a 16-year-old daughter recently diagnosed with PCS. It just says she has never. And then she's allergic to NSAIDs, asthmatic, and also has an ovarian cyst. How can the herbs help someone of this age? I think particularly important for somebody of this age to address this now, because when these get very embedded, they can be much harder to shift. So if I had a 16-year-old with that diagnosis, I would definitely see a medical herbalist. And you can use these things in the meantime. People think you have to have everything sorted before you see a herbalist. And it's the other way around, guys. You see a herbalist, you keep the chain of investigations, but you try and solve the problems while you're waiting for scans or colonoscopies or whatever's. It's that's you don't wait until everything is named, because the names aren't that important. You see, these would be considered two different diseases, but the management is virtually the same. The other effects of the herbs are all in favour of preventing being affected by the chronic disease epidemic that is surrounding us all.
Yeah,
we're all hovering now, kind of, to say let's say goodbye, but not without.
So we have a few more questions that we got through email. So the first question is, what are the silent symptoms of endometriosis, if there's any?
Okay, I deliberately didn't go into all of that, because all you have to do is Google it. Mm-hmm. All right, and what I wanted to do was bring out the complexity and the multiple systems involved. But the direct symptoms are all so available, guys, and AI will summarize them all for you. You don't want to rely entirely on AI, but for many things, if you're doing an in-depth research or whatever, but for most of this, you can, it'll give you a list of symptoms. So yeah, good question, and I'm going to leave it to your resources.
The next one is, can endometriosis cause bowel issues?
Yes, it can. Endometriosis can seed. It's the lining of the womb. It goes to lots of other tissues in the body, and it can lodge either behind the uterus, overlapping with the bowel, and it can cause, very, very rarely, it can penetrate into the across the bowel wall and actually cause bleeding that coincides with the menses. That's rare. I haven't seen it in 46 years. But it can also be part of the motility problem, irritable bowel. There's a big overlap between the two of those as well. And lots of people get slight bowel alteration with their periods even without having endometriosis. So it's not specific, but it can certainly be increased.
And our next question is, what can be mistaken for endometriosis?
Everything.
Oh.
One of the problems with endometriosis is that it can take people 5 years and 5 different consultants or consultations. It's diagnosed by laparoscopy. That's the definitive diagnosis. But PMS, pelvic pain disorder, it can just be ignored because, you know, one of the biggest problems for women is each woman has a period. They don't know what other people's periods are like. They don't know what's normal. We don't have, people have different pain thresholds. That's a big one. So they can be, yeah, it takes a long time to get an accurate diagnosis and treatment plan. Yeah.
So our last question for the day is, I am on the progesterone only pill to stabilize 2 large endometriomas before getting surgery.
Yeah.
Really tried to resist it. What can I do to minimize the effects of it?
Minimize the effects of the endometriosis or the surgery, or sorry,
so I believe the user meant that she is on the progesterone only pill, which is causing the issue. So probably on that basis, she's asking for help on what can she do to minimize the effects. Like, she's not
to minimize the side effects of the progesterone.
Yeah.
All of the food, you know, the fenugreek, I didn't mention fermented foods. Sure, I could go on for another 2 days. Fermented foods, very good for the gut flora. The fibre will help with elimination of the breakdown products of the progesterone. The liver herbs will help with metabolism of medication as well as the herbs. Sleep will help her healing powers. So it's not specific, but these are common symptoms for people who take HRT as well, because they have side effects of the progesterone. I think that whole approach for healing would also be good for healing with the surgery for you. So I hope that's helpful.
The winner of hamper.
Oh, the winner of hamper.
So your hamper.
Lovely hamper women's wellness gift set is Elva Lisa.
Way,
Okay, great. I'm delighted for you, Elva Lisa. So you contact the clinic, and do you need me to do anything else, guys? Bye bye. Lovely chatting to you all. Thanks for all the feedback. Lots of questions. We want to build up the community of people who, and listen to my the Herb Doctor podcast, because it gives not just for these conditions, but for lots of other ways of thinking about how to turn vicious cycles into virtuous cycles. So take care. Bye.